Hi, my name is Wade Phillips. I'm the clinic director, chiropractor, and a medical acupuncture provider at Summit Sports and Health. Summit Sports and Health is a multidisciplinary health clinic, so we offer a lot of different services. The idea is basically working as an integrated health clinic where we have multiple people that can serve a single person. We can better manage each individual that comes in. So we have chiropractic, physiotherapy, massage therapy are sort of the core services, and we built upon that as well with registered dietitian that's in office, as well as psychologists. So the majority of my workday is seeing patients. Usually 5 to 6 hours of my workday is occupied in appointments. And then usually at the end of the day is when I kind of dedicate my time more on the business side of things in terms of managing the clinic and taking care of some of the business items that I'm responsible for. I used to do a lot more of that. I've got a clinic manager now that I've been able to offload a lot of those tasks. So the work, the sort of business side of things, it's not nearly as much as it used to be. But usually it's an hour or two, usually at the end of my day, that I dedicate to sort of sitting down in front of a computer and actually taking care of some of those tasks. So I guess probably from my high school years, I kind of knew that medicine or health or somewhere in that area is definitely where I wanted to be. Sort of end of high school and start of university, I used to be an athlete and dealt with a lot of things in terms of injuries and physical issues that sort of ended my athletic career. And so I think that's probably where interest specifically in sort of sports medicine, physical medicine became interesting to me and kind of eventually got me to where I am now. In terms of choosing to be a chiro. Through some of those experiences and people that I met, and the more I learned and became informed on each of them, I ultimately decided to be a chiropractor. And then during my chiropractic education, diving into research and becoming again more well-read in terms of physical medicine, that's where medical acupuncture became something that I wanted to do as well. Really exciting, great research base in terms of the effectiveness of medical acupuncture. And so that's something that I pursued concurrently at the end of my chiropractic studies. I did a year concurrently for my last year of chiro school. Also studied and got my medical acupuncture certification. We do differentiate between an acupuncturist, which is generally speaking sort of a traditional Chinese medicine practitioner, acupuncturist. It's the same tool in terms of using a needle. It's an acupuncture needle or a dry needle. The thought process, the theory, the research behind it's a little bit different. So we differentiate, as a medical acupuncture provider, we differentiate that from what an acupuncturist, where the acupuncturist is using more traditional methods. An acupuncture provider, clinical or medical acupuncture provider, it's more modern research in terms of studying what the physiology, what the physiological effects are of inserting a dry needle into a muscle or any tissue in the body. What is the observable effect and how can we use that to our advantage? So for me, I started my undergraduate studies at University of Saskatchewan. I actually did 2 years initially in anatomy and cell biology, and then switched my major to physiology after that, and decided I want to do an honors research project at the end of my undergrad years. So I actually spent 6 years in undergraduate education at the U of S. Most people that move on to chiro school, generally speaking, they're doing a 4-year bachelor's degree in terms of their undergrad. I liked school, so I stayed a little bit longer. After that, you go into the doctorate program to become a chiropractor. That's another 4 years. So I did 10 years of university. Most people probably do 8 total. And then, like I said, sort of my last year of chiro school, I killed my social life, and I also did my acupuncture training during that year so that when I graduated, I was certified to do both. With any professional, after graduating from university, the learning doesn't really stop there. There's a lot of continuing education, seminars, courses that you try to take to improve your skills, whether it's diagnostic or treatment. So always, taking new seminars, taking new courses, trying to become better at what we do. I love a lot of things about my job. Probably first is I like working with people. It's a very social job, and you get to work with people, you have goals, you can kind of see those goals being met, hopefully most of the time. So that's very rewarding to be able to work with people, work towards a goal, have success and feel like you're helping somebody with their quality of life and whatever they're going through. I also get to work with a fantastic group of people, so the other practitioners at the clinic. It's always a privilege to be working with them. And the active side of the job, I mean, yeah, it's not sitting at a desk all day. That's honestly one of the best things about my job versus sitting at a desk and feeling probably at the end of the day that you need to go and get a run in or get some exercise in. It's like an all-day workout for me. I think definitely someone well suited for the job would be social or comfortable in social situations, because your day is mostly comprised of talking with people. So that's definitely an important part. I think another important part is you need to like school, because it's a lot of school. So, you know, if you're looking for a 4-year university degree and then that's all you can handle, it might not be for you. But so you have to like school because you're going to be in school for a long time. But once you're out, definitely you need to be social. It's a big part of the job. You need to be active, so you should be someone who enjoys physical activity and moving around. If the idea of sitting in a desk appeals to you, it's not a lot of sitting. So that's definitely part of it as well. Yeah, academically, definitely focus should be on your core sciences. So high school, you don't get too specialized, but you want to make sure that you've got a strong background in science. And once you start undergraduate studies, you definitely want to get those core sciences. In terms of practical experience, getting in, and if you have an opportunity to observe at a chiro clinic or an acupuncture clinic, just to actually immerse yourself in the environment a little bit and see what it's like and what exactly we do. Something that I do actually is oftentimes a lot of the front desk staff are students, our part-time staff. They tend to be students, and they tend to be students that are looking to go into physiotherapy or chiropractic or one of the services that we offer. And that way it's a great experience for them where, you know, they're working a part-time job that agrees with their academic schedule, but they're able to actually be in the environment that, you know, they aspire to one day work in. Any opportunities like that to actually get in, see it. If you don't necessarily have the opportunity to shadow at a clinic, I mean, go in as a patient if you wanted to. You can see how chiropractors work or physiotherapists work, and usually getting exposed to, there's a lot of different styles and there's a lot of different types of practice amongst the profession. So to expose yourself to different professionals and see how everybody works differently and see what sort of jives with you best. I think the more you can observe it and immerse yourself in it, the more you're going to understand what the career is all about and whether or not you're well suited to it. So my best advice for a high school student is to find what you truly enjoy doing. And if you can make that your job, then that really is the right job for you. If you can show up every day and enjoy what you're doing, you're going to be very fulfilled in your career.